Tadalafil, better known as Cialis, is often seen as a miracle pill. It promises stronger performance, renewed confidence, and even health benefits for the prostate and lungs. But here's the truth few people talk about. For some men, Tadalafil is not just unsafe, it can be downright dangerous. Did you know that certain medical conditions make Tadalafil a serious risk? For these men, taking just one pill could trigger a sudden drop in blood pressure, vision problems, or even a heart attack. And yet many don't realize they fall into the do not use category until it's too late. In this video, we're going to uncover exactly who should not use Tadalafil. You'll discover the heart conditions that make it dangerous, why uncontrolled blood pressure is a red flag, which men face risks after a recent heart attack or stroke, why liver and kidney problems make Tadalafil unsafe, and the dangerous drug combinations that can turn this pill into a deadly trap. And stay with me until the end, because I'll reveal the #1 mistake men make with Tadalafil, a mistake that has put thousands in the hospital. So before you or someone you love ever takes Tadalafil, you need to know if it's truly safe for you. Tadalafil has become one of the most widely used medications for men's health, and for good reason. For millions, it represents a return of confidence, intimacy, and quality of life. Here's why so many men turn to it. Erectile dysfunction, ED. Tadalafil helps men achieve and maintain stronger erections by improving blood flow. Unlike Viagra, which lasts about 4 to 6 hours, Tadalafil can last up to 36 hours. That's why it's called the weekend pill. Prostate benefits. Men with benign prostatic hyperplasia, BPH, often struggle with frequent urination, especially at night. Tadalafil relaxes the muscles around the bladder and prostate, making urination easier. Lung and heart benefits. In cases of pulmonary arterial hypertension, PAH, Tadalafil helps lower blood pressure in the lungs, improving breathing and exercise tolerance. No wonder it's seen as a miracle drug. It improves not just performance, but also daily comfort and even heart-lung health. But here's the catch. Not every man can use it safely. In fact, for certain conditions, Tadalafil can make things much worse. For men with certain heart conditions, Tadalafil can be far more dangerous than helpful. Here's why. Tadalafil relaxes blood vessels and lowers blood pressure slightly. For a healthy heart, this is usually fine, but for a weak or diseased heart, that extra strain can trigger serious problems. Who is at risk? Men with unstable angina, chest pain that comes and goes unpredictably. Those with severe heart failure, where the heart is already struggling to pump blood. Men with serious arrhythmias, irregular heartbeats. Remember, sexual activity itself already puts stress on the heart. Adding Tadalafil into the mix can push some hearts beyond their safe limits. That's why doctors often warn, if your heart isn't healthy enough for sex, it isn't healthy enough for Tadalafil. But heart disease isn't the only red flag. For men with uncontrolled blood pressure problems, Tadalafil can also become very risky. And that's exactly what we'll uncover in the next chapter. Tadalafil directly affects blood vessels by relaxing them, which leads to lower blood pressure. For most healthy men, this drop is mild and safe, but for men with unstable blood pressure, it can be dangerous. Who is at risk? Men with very low blood pressure, hypotension. Tadalafil can push it even lower, leading to dizziness, fainting, or collapse. Men with uncontrolled high blood pressure. Even though Tadalafil lowers pressure, the interaction with blood pressure medications can cause unpredictable and dangerous swings. Men taking alpha blockers, often prescribed for prostate problems. These, combined with Tadalafil, may cause an extreme drop in blood pressure. What feels like a simple pill could actually send your circulation into chaos if your pressure isn't stable. But blood pressure isn't the only concern. For men who have had a recent heart attack or stroke, Tadalafil carries even greater risks. And that's what we'll cover in the next chapter. If you've recently had a heart attack or a stroke, Tadalafil is considered highly unsafe. Here's why. Both conditions mean your blood vessels and heart are already under stress. Sexual activity itself increases heart workload. Tadalafil lowers blood pressure and alters circulation, which can push your heart or brain past a safe limit. Who is at risk? Men who had a heart attack within the last 6 months, men who suffered a stroke or mini-stroke, TIA, in the same period, men with ongoing chest pain or shortness of breath linked to heart disease. Doctors often say, if your heart isn't healed enough for normal activity, it isn't ready for Tadalafil. But the heart and brain aren't the only concerns. For men with serious liver or kidney problems, Tadalafil can build up in the body to dangerous levels. That's exactly what we'll explore next. Tadalafil is processed by the liver and eliminated through the kidneys. When either of these organs isn't working properly, the drug can build up in the body, leading to dangerous side effects. Who is at risk? Men with severe liver disease, such as cirrhosis. Their bodies can't break down the drug efficiently. Men with advanced kidney disease, especially those on dialysis. Their bodies can't clear Tadalafil out, causing it to linger much longer than normal. What happens if it accumulates? Stronger side effects, like intense headaches, back pain, or prolonged erections, higher risk of sudden blood pressure crashes, increased chance of dangerous drug interactions. Doctors may sometimes prescribe smaller doses for men with mild liver or kidney problems, but in severe cases, Tadalafil is strictly off-limits. But liver and kidney disease aren't the only special cases. There are also other hidden conditions and drug interactions that make Tadalafil risky, and we'll cover them in the next chapter. Beyond heart, blood pressure, liver, and kidney issues, there are several specific conditions and drug interactions that make Tadalafil unsafe. Special cases. Men taking nitrates, like nitroglycerin for chest pain. This is the deadliest combination. It can cause blood pressure to crash to life-threatening levels. Men using recreational poppers, amyl, or butyl nitrite. These act just like nitrates and can trigger the same catastrophic collapse. Men with rare eye diseases, such as retinitis pigmentosa, PDE5 inhibitors like Tadalafil may increase the risk of sudden vision loss. Men with severe allergies to Tadalafil or other PDE5 inhibitors. Even one dose can trigger swelling, rash, or difficulty breathing. Many men underestimate these risks, assuming it won't happen to me, but thousands of emergency room visits each year are linked to these exact mistakes. And here's the bigger problem. Even men who can use Tadalafil safely often put themselves at risk through everyday user mistakes. That's what we'll reveal in the next chapter. Even men who are technically eligible to take Tadalafil often make mistakes that raise the risk of side effects or serious complications. Here are the most common ones. Taking more than prescribed thinking. More means better. Some men double up on doses. This doesn't improve results. It just multiplies risks. Mixing with heavy alcohol. A drink or two is usually fine, but binge drinking combined with Tadalafil can cause extreme dizziness, fainting, or dangerously low blood pressure, expecting instant results. Some men panic when they don't see an erection immediately and take more pills. Remember, Tadalafil only works with sexual stimulation and needs time to be absorbed. Using counterfeit pills. Buying Tadalafil online from shady sources is a huge risk. Fake pills may contain harmful chemicals or no active ingredient at all. Ignoring warning signs. Chest pain, sudden vision or hearing changes, or a prolonged erection are not normal. They are emergencies that require immediate medical care. The bottom line, most risks don't come from Tadalafil itself, but from how it's used. Now let's bring it all together. In the final chapter, we'll answer the big question: who should absolutely not use Tadalafil, and how can others use it responsibly? Oh, who are the men that should avoid Tadalafil completely? Do not use Tadalafil if you have serious heart disease or unstable angina, suffer from uncontrolled high or very low blood pressure, experienced a heart attack or stroke in the last 6 months, have severe liver or kidney disease that prevents your body from processing the drug safely, take nitrates or recreational poppers. This mix can cause a fatal drop in blood pressure, live with rare eye diseases, or have had severe allergic reactions to PDE5 inhibitors. The number one deadly mistake? Combining Tadalafil with nitrates. This single error has sent countless men to emergency rooms, and it is 100% preventable. For men outside of these risk groups, Tadalafil can be safe and effective if prescribed by a doctor and used correctly. Now I want to hear from you. Did any of these risks surprise you? Do you think most men actually know who should and shouldn't use Tadalafil? Drop your thoughts in the comments. I'll be reading them. And if this video helped you, don't forget to like, share, and subscribe for more science-based health insights. In the next video, we'll explore another hidden truth about men's health, one that could change how you think about your heart, your performance, and your future. Stay informed, stay safe, and I'll see you in the next video.